for going and doing those tests and reporting them in our register. It is really important. If you can't access that register online, you can ring the 134 COVID number to register a positive rapid antigen test. We sadly have had 6 more deaths overnight, and our condolences go to the families and friends of these individuals. I will get the Chief Health Officer to go through a bit more detail about these individuals, but sadly one of those people are in their 20s. So, any loss of life is sad, and I do want to pass on our condolences to those families. We've got 649 people currently admitted with COVID in our hospitals, in our public hospitals, 46 in ICU now, and 14 of those are ventilated. We've had 42,707 tests in the last 24 hours, PCR tests. So I thank people for still coming forward. If you cannot get a rapid antigen test, and you cannot, you can still come forward for a PCR test as well. Our percentages now, as far as vaccinations of our 16-year-olds plus, is 91.48%, and it's great to see our first doses continuing to go up, and 88.51% second doses. I am thrilled to look at the 5 to 11-year-old data in Queensland. We are now at 8.54% of all eligible young people between the age of 5 and 11 who have already got vaccinated in Queensland. And there's 40,867 of those 5 to 11-year-olds who got vaccinated in the last 24 hours across Queensland, both in our state clinics but also pharmacies and GPs. And I want to thank the pharmacies and GPs for the work they're doing, not just with young children. Don't forget, your teenagers, if they haven't been vaccinated yet, please come forward. And also, if you are eligible for your booster, or if you haven't had any vaccine at all yet, please come forward. Boosters, we did 800, we're up to 888,909 people in Queensland who have now had their boosters. We did get some of the some additional supply of rapid antigen tests yesterday. We are expecting more to arrive today and more over the next couple of days, and we're just waiting for confirmation from the Commonwealth when our orders will arrive for those as well. But we're pleased that we are seeing some extra come in, and we are distributing some of those through our public testing sites and also, of course, to our public health units. I also, and I know the Chief Health Officer is going to talk in more detail about this, about who should be ringing 000 if you test positive. It's really important you listen to this information. Our ambulances and our paramedics are under a significant strain with the calls that they're getting, and we want to make sure that we don't have people ringing simply because they've got a positive test but otherwise are feeling well. There are other avenues if you want to seek advice and assistance as opposed to calling 000. Also, many of our hospital and health services are being contacted, as is Queensland Health. Family members are upset or concerned that private residential aged care centres are either locking out visitors or restricting visitors. This is a decision of the individual residential aged care facility to do this, but we do ask families to understand why this is occurring. There are many outbreaks in residential aged care across Queensland now, many facilities that have positive cases both in residents and staff. And any measures that those facilities are taking is to try to reduce the risk of exposure of those who are yet to get the virus. We know this is our most vulnerable in the community. Those facilities may not have all had their booster shot yet, and so we do ask for an understanding. We do have at least one facility where we're concerned as far as staffing levels. They've reached out to us because they've had such a large number of cases in residents and staff over the last 2 days, and they're needing staff and they're needing PPE. I spoke very briefly to Greg Hunt this morning. I'll be talking to him after this press conference to ensure that the Commonwealth are able to provide the support they need because it is very difficult for the public system to step in and provide staff, or potentially relocate those residents into our facilities if that is needed. And we know that needs to be a last resort for those residential aged care facilities. I'll now hand over to the Chief Health Officer just to talk a little bit more about those deaths and also what people need to do when they are seeing symptoms of COVID. Thank you.
Thank you very much, Minister. Sadly, we have 6 deaths to report today. 1 person in their 20s, 1 in their 70s, 2 in their 80s and 2 in their 90s. All of these people had in fact received vaccine. It is a reminder that even the vaccinated can get severe disease, particularly if you have underlying medical issues. All of these individuals had significant underlying medical problems. They all had significant underlying medical problems, and I don't want to go into any more detail than that out of respect for the families, but our thoughts are with the families. So we now have a total of 649 people in hospital requiring treatment for COVID-19. That includes 46 patients in hospital in intensive care, of whom 14 were ventilated. You may note that this is an increase of 10% across the board in the last 24 hours leading up to 7 p.m. last night. So there was an increase in cases in the Queensland hospitals of 10% in the 24 hours leading up to 7 p.m. last night. So you may recall that on Friday the number was 589 in hospital and 41 in intensive care. Although this is only one day, it is what we expected, and we need to look for a trend, but it is quite likely that we will continue to see this increase over the next 2 to 3 weeks. This is what we have been projecting, and it's likely there is a good chance this is the beginning of that final surge before we reach a peak sometime in the next 2 weeks. I mentioned yesterday that peak would not be even across Queensland. At the moment, the biggest increase are in southeast Queensland, still increasing in the Gold Coast and Brisbane south of the river, but also north of the river as well. And this is exactly as predicted as we head into the peak in the next 2 to 3 weeks. What I would like to talk about is how to approach COVID from a personal point of view. Now, as we are approaching the peak, if you have any of the symptoms suggestive of COVID, if you have flu-like symptoms, then it's likely that you have COVID. It is likely that you have COVID. If you have headache, runny nose, muscle aches, perhaps a cough, perhaps chills, if you have that constellation of symptoms, at this present time, it is very likely that you have COVID-19. Now, sometimes if you have mild symptoms, which is particularly common in those who are vaccinated, it can be very hard to pick, and it's very hard for us to pick as well. But if you have the classical flu-like symptoms, chills, cough, runny nose, headache, muscle aches, assume you have COVID-19. Now, we would like you to get tested with a PCR test or rapid antigen test if possible, but if for whatever reason you're finding that difficult, you should just assume you have COVID-19 and isolate. But it's no need to be anxious or panic. For the vast majority of people, particularly otherwise healthy, vaccinated adults, you will have a mild illness similar to any respiratory infection that you've had in the past. For the more vulnerable, particularly the elderly and those with underlying immune disorders, should we hold for a second for that? Sound okay? Continue. So if you are elderly or have underlying immune disorders, it is particularly important that you get that booster. But anyone who is entitled to that booster, that is present 4 months after the last dose, should get that booster. Now, if you have either confirmed COVID-19 or possible COVID-19 based on the symptoms you've experienced, so what's presumed COVID-19, please don't panic, please don't call the ambulance. The symptoms you need to look for, the question that I'm most frequently asked, when do I need to go to hospital? When do I need to call an ambulance? Well, probably the single most important symptom to look for is difficulty breathing. And people say, well, people have never seen someone with difficulty breathing, say, well, what does that mean? I don't understand what you mean by difficulty breathing. What I mean is, if you're just walking a short distance, say 40 paces, or between rooms in your house, and you find you have to stop to take a breath like that, after just walking between rooms in your house, that's the sort of thing that suggests that you have difficulty breathing, and then you probably need to come to hospital. So just walking a short distance, say between rooms in a house, and having to stop to catch your breath as if you've climbed a steep hill, that's the time to be thinking about calling an ambulance. Not just because you have COVID-19, not just because you have a fever or runny nose or cough. Other symptoms to be looking for are chest pain, particularly chest pain, significant chest pain that doesn't go away. A little bit of chest pain with coughing is not uncommon, but I'm talking about significant chest pain that doesn't go away. Sometimes coughing up blood, which we see that sometimes, and sometimes fainting. We sometimes see that in people that are significantly unwell. But the main one is that, if I can just emphasise that, the difficulty breathing. Walking, it's typically people talk about, they get out of bed, they walk to the bathroom, or they walk to the lounge room, and they find they have to stop to catch a breath. That's the symptom where you should be calling an ambulance and coming to hospital, not just having a fever. Now, if your fevers and other symptoms, most people's symptoms, their fevers and other symptoms will improve within 72 hours of onset, within 3 days. If you have a fever and you're not clearly improving within 3 days, I would also seek medical advice from a doctor if it's not improving within 3 days. But the one where I think where we need to think about an ambulance or dialing 000, it's that walking between rooms. I just can't catch my breath. I've just got up from this chair and I walk around the house, and that's typically what people with severe COVID describe. We saw that a lot in the early days, in particular I saw that overseas with the unvaccinated young people. So it's not so much now with vaccinated young people. We're not seeing that so much. Now we're talking mostly the unvaccinated, who are taking up a disproportionate number of beds in hospitals around Australia, and also older people and people with other significant medical conditions. And that's, although we do know that having that third booster dose does decrease the chances of even that group from requiring hospitalisation.
I'll just ask, medically, to place someone into ICU,
yes,
is it a decision of the doctor because it's the best to treat them in ICU, or they're placed there because they're so sick?
There are criteria for admitting patients to ICU. It's usually related to the level of oxygen that's measured in the patient's blood. If the oxygen levels gets too low, that's when we usually transfer to ICU.
Just excuse me,
Yeah, sure.
ICU, are you placed into an induced coma? Or
No. So the ones that are placed in induced, they're the ventilated ones. So speaking to the intensivist, the intensive care specialist, the trend in managing COVID-19 is to try not, if possible, to put people on ventilators and put them into induced coma life support. We're trying to keep people off that. They have other techniques. One of the techniques we're using in hospital is called proning, awake proning, where you get people to lie on their tummy, or lie face down, and that improves the oxygen levels in their blood. So if you turn people, lie them on their tummy for several hours a day, and then they lie on their back. And with using that technique, it's found that we don't need to put as many people into induced coma and ventilation as was once required.
And just on those patients that are on ventilators or in ICU,
yes,
are you finding, Doctor, that they're Omicron or they're Delta? Do we know?
In Queensland now, well over 95% of the viruses we're seeing are Omicron. Delta, definitely, we were more likely to end up in intensive care, definitely. There are a significant number of unvaccinated people, as you know, in intensive care. But even vaccinated people with underlying medical conditions particularly can end up in intensive care, particularly. And occasionally there will be random people where it's not obvious why they get so sick. It does happen. A young person just gets sick for no obvious reason.
We want you to get a test, but if you can't, assume you have COVID.
Yeah.
How many, given the supply of that test, given the numbers we're expecting, how many people are going to be in that situation?
It's a good question. And the reality is we don't know around Australia. In planning for pandemics, once you get past a certain point, testing becomes less and less critical. We want people to get tested. We want to be able to monitor them. But the fact that we are not necessarily testing every single person and missing some that's not a major failure of the system. Because, I mean, we used not to have things like rat tests. That's a new concept. So most of our planning for pandemics has assumed that at a certain point we would just treat people based on their symptoms. Now, ideally, we will get significant more rat tests so people can confirm their diagnosis. But the fact that we don't, particularly if you have the typical symptoms, now as we're approaching the peak, you can diagnose yourself. The hard ones to diagnose, to be honest, are the people who've been vaccinated, who have very mild symptoms. Those are the hard ones, not the ones with obvious symptoms. So if you have the obvious symptoms that I just described before, now you've got COVID. Yes.
Without wanting to talk through their other medical issues, what were the circumstances of their death and when did that?
My understanding, and so I'm just trying to recall, my understanding it was reported it was reported to Queensland Health yesterday, so I report that immediately. But I think that he may have died a number of days ago. I don't know the exact day. It was a number of days ago, and I don't know the precise circumstances. I do know that he had significant underlying medical problems. He was known to have COVID at the time, yes. I believe he may have been at home. I believe he may have been at home when he died.
Minister, it's the ground that we're going to cover here now is very delicate. Just on the ambulance situation here, would you be able to just give the public some insight into just how stretched the ambos are at the moment, and again relay that message to people about not needing an ambulance, but without telling them that they don't have to not,
Look, first and foremost, if you need an ambulance, if it's an emergency, if it's life-threatening, you call AAA. Don't hesitate. Our paramedics are out doing an amazing job, and talking with the centre at Kedron the other day, who not only do the calls for southeast Queensland but are able to monitor statewide what is happening. Yes, we have pressure in the systems, but because of some of the initiatives we've set up where we can triage those calls that are COVID related, and I know the Commonwealth announced during the week, I don't know if it's got live yet, but Paul Fletcher announced that Telstra was changing the messaging when you call 000 to say if this is about COVID, there is another site or number you can ring to get support and assistance if it's not an emergency. So the Commonwealth is trying to take pressure off our 000 line as well. Certainly our message is don't ring 000 simply because you've done a test and found out you're positive, but otherwise you have no or very mild symptoms. But on our website, it talks about how you can track your symptoms, and the Chief Health Officer has just gone through and talked about what is an obvious sign of needing an ambulance, such as shortage of breath and what that means. So I don't want to in any way discourage people calling 000 if it's an emergency, because we know you need to get to hospital and need that care quickly. But just please, be mindful. If your symptoms are mild, you do not need to come to hospital, and please don't call 000 simply to be transported to a testing clinic or a vaccination clinic because you're concerned you've got symptoms. You can travel by your own personal vehicle to go get a test, and if need be, you could call a taxi or Uber, ride sharing, if you take all the precautions. But you don't need an ambulance to transport you, simply to go get either a free test or a PCR test at a testing clinic. Look, they weren't able to give me a definitive number. They said that it had improved during this week, but I've heard overnight we're seeing more people calling again simply because they've got low low symptoms. So it seems to go in waves, and we just need to keep reinforcing that message that 000 is not the number you ring if you have mild symptoms of COVID or you think you've got COVID and you simply want to test. Yeah, look, we had a briefing this morning. The police commissioner sounded very happy that the barricades are down, and I have no doubt there's a lot of happy people, family members who are now able to reunite again, not wait for those PCR tests or wait for those rapid antigen tests to be able to cross the border. And I remind everyone who is travelling into Queensland, whether you're a Queensland resident or a visitor, we have restrictions in place. We have mask wearing that is mandatory for indoor places. We have restrictions on only vaccinated people going into certain venues and staff required to be vaccinated, and that applies to everyone in Queensland. So if you are visiting Queensland on holiday or visiting friends or family or moving to Queensland, please follow these rules because that's what will help us keep people safe. As the Chief Health Officer has said, we believe we're starting our surge. We're on our way to our surge and towards our peak, and we know the numbers are going to grow, especially our hospitalisation and ICU going forward over coming days and weeks, and we ask everyone to do their part to help the amazing health workers who are putting themselves on the front line to care for everybody. No. It is a range of patients. So it'll be patients who are in hospital for other reasons. These are clinical decisions as to who is best to move, who are in the existing hospital system, but also those who need hospitalisation, who we may send straight to the private hospitals instead of admitting them into one of our public hospitals. So these are clinical decisions made at hospital and health service level as to who best to move so that we can manage COVID patients in our wards. But obviously if we need to have overflow in COVID patients in private hospitals, we'll manage that as well. I'll ask the Chief Health Officer to address that. I don't believe so, but of course if we end up needing extra capacity, we'll do whatever we can and utilise whatever resources we have. But I believe the ICU patients that are COVID positive are being managed in our public health system. I don't know if the Chief Health Officer can...
I'm so sorry, I couldn't quite hear the question, I'm sorry.
In terms of the private bed,
yes.
Is it, say you're an ICU currently in a public hospital, whether you have COVID or not, could you be moved to a private hospital, or are you even moving ICU patients to private hospitals?
Not at this stage. We believe we have... Okay, the specific question around whether we're moving COVID patients to other ICUs other than public hospital, the answer is that is not the plan. We could, at this stage, I don't... So sorry. Okay. So we have capacity in our intensive care units to deal with the COVID patients. That's in the public hospital COVID patients. So there is no plan at this stage to move intensive care patients with COVID to the private hospitals. Whether or not private hospital intensive care beds are used for other purposes like post-operative or that sort of thing, I'm not sure. It's possible, but when there's no intention to transfer COVID patients from the public hospitals to the private hospitals.
Gerrard, and I'm sure the Minister will touch on this too, moving into this wave, will your advice be, or are you currently considering putting some restrictions in place around our aged care facilities and hospitals and prison systems, those vulnerable spaces?
At the moment we're looking at specifically at reducing the number of visitors to public hospitals. That's probably our primary focus at the moment, and we're just looking at that actively at the moment. The decision around aged care, there are already restrictions in terms of visitors requiring to be vaccinated, of course, both in hospital and in aged care facilities. We have not specifically put restrictions on visitors to aged care at this stage.
It's definitely something you'll have to visit though, isn't it? I mean, considering if we're starting to get that big wave, I guess we have to.
We're in a very different world to 2021 and 2020. Even in the aged care facilities where there are patients infected with COVID-19, it's just not the same. Most of them are recovering and doing well. So the idea of the aged care lockdowns that we saw, the wide-scale aged care lockdowns, if that's the nature of your question, that we saw a year ago, I can tell neither at state level nor at national level at this stage is there any intention to do that.
Minister, the government's definitely, obviously, yourself, the Premier, the top in the cabinet, would probably be discussing this.
Yeah, we actually had a meeting with stakeholders, with health stakeholders yesterday, with the chief executives of all the hospitals, consumer advocates and other groups, just around visitor limitations in our hospital system. I suspect we'll make a decision on that very shortly, but I'm just going to be briefing the Premier about those discussions that we had yesterday afternoon. As in relation to aged care, I'm finding residential aged care are regulating themselves right now anyway, and are already limiting visitors in those facilities. Not yet. We'll probably be early next week. We'll be letting everyone know exactly. We understand the importance of probably having a definitive date as opposed to just waiting and hoping we tick over that 90% mark on any given day. We know people are making travel plans right now. People are making plans to return back to Australia or arrive in Australia. So we want to give them as much certainty. So more than likely we'll announce a date. We're just looking at when that should be right now. Oh look, we're over 88.5 now. We're roughly moving at 0.2 a day, but look, in the next week I would think we're going to hit that 90% double dose. Look, if you remember back in 2020, the Premier stood up with the Deputy Premier, then Health Minister, and showed what we're capable of doing if need be with, you sort of pop-up triage wards in convention centres and those sorts of things. All those plans have been there since day one. Our modelling so far, we do not believe we're going to need to activate that level, but of course, we are ready if we need to, but we don't. The option is always there, not in hotels. Where we would use, those sorts of situations are people who are COVID positive but don't need hospitalisation. We've got people who are homeless, people who are particularly vulnerable who cannot actually reside in their home but are positive and need to isolate. We'll have holiday makers who are at the end of their holiday and find they've got nowhere to stay, but they've now got to isolate for 7 days. They don't need hospitalisation. You can look at other arrangements like hotels for those people, but no, we would establish sort of pop-up wards if need be. But the modelling so far, we believe that the peak we can manage within our both public and private hospital system. There is a facility in Toowoomba.
Is that a consideration?
Look, all of those things are being considered, absolutely. Yes. Yeah, so look, I think I said at the start of the week we were looking at hopefully bringing 800 online by the end of this weekend. As I say, yesterday it was 637, so I think more coming online today and tomorrow. We will be looking at that next stage of what we want by the following week. So we're doing, how many we needed this weekend, how many we need by next weekend, knowing the surge is coming. So we will absolutely be seeking to secure more private hospital beds in the following week. The capacity in the private system, I think they've got 5,000 to 6,000 beds in the private system. We've got about 8,000 bed capacity. That's not our total beds, but how many we think if we needed to access for COVID. So across both the public and private, we are comfortable based on modelling that we can see this peak through. So privately, what we are securing is not just the beds, but the staff to man those beds. So we are asking the private sector to provide us with 800 staffed beds so that we don't have to pull our staff over from the public health system. We are monitoring this every single day. There is a very, very small number of close contacts. I think it's less than 100 so far that have been brought back into the public health system, and most of them have been for short periods of time. And I think I might have said yesterday, with leave arrangements, they're looking at who already had leave, who haven't gone on leave yet, and suspending that. So all those measures are in place, but we will monitor this daily. My particular concern right now is staffing in aged care, and that's the conversation I want to have with. I raised it with the Commonwealth earlier in the week, and I want to have that conversation again today with Greg Hunt, because I am concerned. And if we have to start pulling staff out of the public health system to go into private aged care, I think that's going to put, well, inevitably that will put more pressure on our system. Look, if we have to, we will. You know, I'm not going to leave vulnerable people in aged care with no staff, but that is not our preference. This is a responsibility of the Commonwealth. They have said all along that they have the plans to do this. They should be doing it. The one facility we're looking at the moment, they've said to us they won't be able to supply us the staff until the 18th. And I don't, you know, that's 3 more days.
Yes,
So.
what about student nurses from the universities that maybe in their second or third year?
Oh, we've been utilising them for a long time.
yeah.
They're in our vax clinics right now. So our student nurses, our student doctors, they're vaccinating, they're testing. So we've been utilising them for some time now. Look, I have no doubt eventually, you know, these restrictions will lift, but we don't have an end date right now. We're at the start of what is really our first big wave in Queensland. So let's get through this. We haven't even hit our peak yet. Certainly not going to lift those restrictions while we're looking at heading into a peak of cases across Queensland. Thank you.
Thank you. Yeah, do we want to do a whip around?
Yeah.